Preventative services has come up on our surveys as a topic that you would like to see included in future webinars. Because there's so many of these services covered by Medicare, we decided to create a series, which will allow us to cover topics in more detail. This series has been split into two components. Part of this series will cover the billing aspect, while the other will be held by our clinical staff, and they're going to concentrate more on clinical benefits, coverage criteria, and documentation. This next slide is our disclaimer. We do our best to provide the most current, accurate information, but as we all know, Medicare rules can change often. The information that I am presenting is accurate as of today, but the CMS website should be checked often for updates. CMS prohibits recording of this webinar for profit-making purposes, so that we ask that you do not record the presentation. This event is being recorded and will be posted to the WPS website as well as our YouTube channel as an encore. Our new website does contain a player which will allow you to view these presentations without having to go to YouTube. We know that not everybody can access YouTube from their work computers, and we want you to be able to get the education that you need. Let's take a look at what we're going to cover today. Since this is the first webinar in a series, I'm going to define preventive services and provide some general information. We'll discuss options for checking eligibility, and I'll provide you with some resources. What is preventative care? Preventative services help patients stay healthy because they allow for early detection of health problems. Chronic disease is one of the leading causes for increased health costs, and it puts a tremendous burden on the patient, community, and healthcare workers. When detected early, treatment can begin when it's most effective, which allows beneficiaries to manage health conditions. Progression of certain diseases can be slowed and sometimes stopped. In turn, this will reduce the cost of treatment. Next, I'd like to give some background and general information on how coverage is determined. Receiving preventative services has been shown to improve health, increase workplace productivity, and reduce the cost of health care. Yet it's been found that Americans are using preventive services at about half of the recommended rate. The Affordable Care Act was signed into law on March 23rd of 2010. It required health plans to provide specific items and services, recommended immunizations, and recommended preventive care and screenings without cost sharing. This act also made it unlawful for healthcare providers who receive federal funding to refuse to treat individuals or otherwise discriminate based on race, color, national origin, sex, age, or disability. Covered services are reviewed, and those that have strong scientific evidence of being beneficial must be covered at no cost to the beneficiary. The U.S. Preventive Services Task Force, also known as USPSTF or Task Force, is a volunteer group that was created in 1984. The 16 members consist of national experts who come from a variety of fields, including family medicine, behavioral health, and nursing, along with some others. These individuals make evidence-based recommendations regarding preventive services. They focus exclusively on services offered in a primary care setting or services that are referable by a primary care clinician and apply to patients who have no obvious signs or symptoms of a specific disease. each service is reviewed to determine if there is evidence that the service is effective, and also what the balance is between the benefit versus harm. The service is then assigned a letter grade of A, B, C, D, or an I statement. Services that receive a letter grade of A or B means it has been determined that the net benefit of the service is high or moderate. Those services receiving a C letter grade are determined to have a small net benefit to patients, and these services should be offered to individual patients based on professional judgment. The task force discourages the use of services receiving a D, as they have found that no net benefit or that the harm outweighs the benefit. An I statement is received when evidence is lacking, is of poor quality, or is conflicting. Here are a few examples of the services that Medicare beneficiaries can receive. Like I said, we will have separate webinars to cover these topics in more detail, so keep an eye on our live events page. If you have specific questions related to a preventative service, please let us know by email in our education email mailbox in the address that Tom gave earlier. When it comes to adding new services, CMS uses the National Coverage Determination, or NCD, process to add these. Services that are within the scope of a Medicare benefit category can be considered if they are reasonable and necessary for the diagnosis or treatment of an illness or disability. Services should also have a grade of A or B from the task force. And in some situations, CMS can add preventative services through its statutory and regulatory authority. I'm going to pause for a minute just to see if anybody has questions on what I've covered so far. So, Tom, has anything come through in the chat yet?
We do have one question, but it's not related to what you covered so far. So I'm going to go ahead and hold that till a little bit later on.
Okay, thank you. Okay, so we're going to move along, and for the next part of the webinar, I'd like to talk about eligibility. Frequency needs to be considered when trying to determine if a patient is eligible to receive a service. We did receive some questions on how to determine the 11-month period. So the count starts beginning the month after the month in which the test or procedure was performed. So for example, if a patient received a screening mammography in January of 2022, then you would begin counting in February until 11 months have elapsed. So this means the patient would then be eligible for another screening mammography in January of 2023. There are other services such as the initial preventative physical exam, and that's only covered once per lifetime. So as we go through this series and we talk about the different services, we're also going to talk about frequency and eligibility. You have a few options for checking eligibility, which I will discuss in more detail. Each MAC has its own interactive voice response system, or IVR, as well as an online provider portal. Part A providers can find patient eligibility using the FIS DDE, and HETS is an option available for our trading partners, which utilizes 270, 271 transactions. Some providers may also use billing agencies or clearinghouses or software vendors. If this is an option that you do use, I will be discussing a CMS resource that contains questions that you should be asking these third-party entities. Information can be accessed at any time using the IVR. This system will require verification by entering your MPI, Provider Transaction Access Number, or PTAN, and the last 5 digits of your tax identification number. This is by no means an all-inclusive list of the information available through the IVR, but I wanted to give you some examples related to preventive services. For cold and flu vaccines, the system will give the vaccine or administration code, the date it was given, and the NPI of the rendering provider if applicable. Medicare Diabetes Prevention Program information will include usage, data service, NPI, and the procedure codes if applicable. Additional information is given for preventive services, but unfortunately, I do not have the ability to access the IVR, so I wasn't able to find out specific details. The secure section of our website is referred to as the portal. The eligibility check option can be found under the My Transactions heading. You will need to enter the patient's Medicare number, their first name or date of birth, last name, suffix if applicable, and the starting and ending date of your service. The eligibility information provided will correspond with the dates you have entered. Now, the portal is a little different because it gives you the option of searching of up to 4 years in the past or 4 months in the future. At the bottom of this slide, you'll see an example of the categories that will appear. The blue box means that there is information available, and if the box is gray, then there would be no information on that tab. The Preventive Services tab will provide the procedure code with professional and technical modifiers if applicable and the next eligible date. For pneumonia and flu vaccines, the system will show procedure codes, rendering providers MPIs and dates of service. COVID information includes procedure codes, immunization date, and rendering physicians NPIs. Other services displayed include the annual wellness visit, depression screening, and screening mammographies and diabetes screenings. There are more, that's just a few of them. You will notice that the Medicare Diabetes Prevention Program has its own tab, and I believe it's because this is a once-in-a-lifetime benefit, and we will be covering this in a webinar next week on diabetes. Part A providers have the option of using direct data entry within FIS. At the main menu, you would select 01 for inquiries, and you would then choose option 10, which is beneficiary common working file information. After entering some key data, you will have access to 6 pages of eligibility information. I've included a screenshot from the DDE Manual. This is, of course, a fictional beneficiary. Services are listed with procedure codes. There are columns for both the technical and the professional components. And some entries will show that the service is not eligible or that it is ineligible due to gender or age. And that's kind of like what you see over here. This would be gender not eligible, and this would be the service is not eligible. Like the portal, there are times when the system may be down, so you would not be able to access the information. The last tool I'm going to mention today is HETS. This transaction provides access to eligibility data in a real-time environment. Providers, clearinghouses, and third-party vendors can transmit a 270 request, which will be processed, and a 271 response will be received. Response files are accurate at the time of transaction and should not be interpreted as a guarantee of payment. When a response is received, it will contain a HCPCS code and the next eligible date for service. This means that the date on which the patient is eligible to receive that service. This could be a future date, meaning that the services should not be rendered at the time the patient is getting seen, or it could be a date in the past, meaning that the beneficiary would currently be eligible for that service. The services shown here is not an all-inclusive list. And if the technical and professional component for a specific service have different eligibility dates, then the 271 response is going to show it in two separate lines. Other services will show up to 10 previous dates of service and rendering NPIs. This would be the case for pneumococcal vaccines or tobacco and smoking cessation counseling and other services that are not considered preventative. I know it can be really difficult to try to get patients to follow up with preventative services, especially when they're not eligible at the time that they are seen. So here's just a few suggestions of how to follow up with patients, maybe get them to open up about symptoms they're having, issues they're experiencing. I've provided you with a list of resources, and I would like to take a little time to go through these because I think they could be really helpful. So I'm going to stop sharing this presentation. Let's go. The first link that you have in the list of resources is the Medicare Preventive Services tool. This allows you to select a service that you want more information on. For example, we'll do the annual wellness visit. So this will give you the HCPCS and CPT codes that are covered. If there is something like a required ICD-10 code, it would be listed here. It tells you what patients are covered. So this says it's covered under Part B. It's not within 12 months of their first Medicare Part B covered period's effective date. Haven't had the initial preventive physical exam within the past 12 months. Goes over frequency. And then it has some information down here about what the patient would be responsible for. And there are some features that give you other notes. So additional information. At the top here, it gives you a symbol and tells you if the service is eligible for telehealth. We can go and select another service. For the Medicare Diabetes Prevention Program, you can see there is no telehealth symbol here. Again, tells you who's covered, frequency. So that's something that's really helpful and can give you a lot of billing information. The next one that we have is the eligibility fact sheet. This talks about the different options that we talked about today. I'm going to scroll down here for just a minute. Trying to do this slow for anyone that may get busy. Down here's the section that I was talking about where if you deal with a third party that can verify Medicare coverage, Here's some suggested questions that CMS thinks you should ask. I know that we have a lot of third-party billers that call into our customer service line. And this is something that CMS has been looking into. It also gives some additional information about HETS with the companion guide. I've also included that link in the resources. Next on the list is the Preventative Services Checklist. And this would be something that could be given to patients. It would allow for discussion on what services would be recommended, and it would also allow the beneficiary to hopefully keep track of appointments, things like that. But it's just something that maybe can be given to a patient to help them follow up on services that they should be looking into. The next resource is for patients. Oops, sorry, let me get back to the top here. This is your guide to Medicare Preventive Services. And like I said, this would be directed to the patient. I'm going to scroll down here a little bit just to kind of show you what's on here. We get down to a service. Here it has the symbols that it's covered for males and females. Talks about how often it's covered, what would the patient's cost be, are they at risk. So this is something that could also, if you have a patient who's maybe a little bit more tech savvy and would get on the internet and look at some guides, that would be helpful. I will be sending everyone some corrected links for the IVR guide along with the portal and the DDE manual. I have to apologize. At the time that my presentation was presented for publishing, we had not moved on to the new website and we didn't have a go live date. So I'm really sorry that those are out of date, but I will get that sent to everybody so that you do have the correct links. The last link would be the companion guide for HETS. And this goes through, it honestly goes through each of the detailed lines of what you're going to get back in the 271 transaction. I'm not sure how many of you would actually look at what gets sent back, or if you have somebody in your billing office that would do that for you. I apologize for scrolling, but I wanted you to see where there is actually an example. It tells you how to get started working with CMS, how to get registered as a trading partner. Gives you the process of how the transaction moves through the system. And kind of explains the elements that you'll see on there. Okay, I'm going to go back now. Okay, Tom, have we gotten any questions that have come through about what I've shown today?
Yeah, we actually do have quite a few questions. So the first one is, according to my research, if a patient presents for a well woman portion of an annual wellness exam at a rural health clinic with a gynecologist, when she's already had the annual wellness visit with her PCP, we can bill a G0101 for the pelvic exam and a Q0091 for the PAP. Should this be coded with the CQ modifier, what revenue code should be used for the G0101 and Q0091 when billing only for the G0101. So I'm going to answer that because I know that Karen did not have time to research that question, but I did. So first of all, the revenue code that you're going to use is for Z052. And that revenue code is just saying that it's a freestanding clinic, which is what an FQHC is. So if you're billing on a UB04, we want you to bill, or I'm sorry, the 37I, we do want you to bill that. I'm actually going to put a article with its title and then a link directly in the chat. Now, this is going to be aimed at Wendy. When you take a look at this article, it's going to give you the information you need. It's going to tell you that you need to bill with the 052. You need to append modifier CG. It's going to give you all of that. It's from our website, so I want to make it as easy as possible for you, Wendy. So I want you to go ahead and grab this article title and link out of the chat. Sorry, Karen, just thought I would answer that so that I didn't have to wait for you to try to research that.
No, I appreciate that. Thank you.
Next question that came in was, and I'm not really sure exactly what they're looking for, but can you address chronic diseases?
Yeah, I would probably need a little bit more information. I don't know if you mean like, can we address chronic diseases in future webinars? We will be doing that. Like I said, next week, I personally will be doing a webinar on diabetes, and so we're going to cover the preventive services that.
Let's see. The follow-up to that, it says at the beginning in the definition.
The beginning in the definition.
That in a slide somewhere at the beginning. Sorry, not sure.
No, it probably is because I had mentioned that chronic diseases.
So it's early detection, effective treatment, and prevention.
So the definition of chronic diseases, it's a broad definition, but it is defined as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily life or both.
Okay, so if you need more than that, I would recommend that you do take that question, email it into us, so we can hopefully get a little bit better what you're looking for and a little bit more information, because I think we're both kind of struggling with this. So next question. So if the patient did not get their Welcome to Medicare exam when he became eligible, can he get the G0438 after 5 years after he became eligible? Now the G0438, for those of you that are not familiar with that code, the initial annual wellness visit, G0439, is the subsequent annual wellness visit.
Okay, so they're asking if they can get the annual wellness visit 5 years after getting entitled to Medicare Part B?
Correct. The answer to that is yes.
Yeah, because,
yeah.
Go ahead, Tom.
Go ahead. Oh, okay. So the G0402 is eligible in the first 12 months. But after that, anytime after that, the G0438 can be billed. G043 does not have a time frame associated other than not during the first 12 months. Now, G0439 does have a very specific time frame because it has to be 11 months after a G0438 is billed. So if you haven't billed a 438, you can't bill a 439. You can't bill a subsequent to nothing. So the first one, which is the IPP, the initial wellness, the initial preventive, is G042. That has to be billed in the first year. Then the next one, G0438, is billed, then a G0439. Even if 5 years, 10 years, 15 years, the G0438 can be billed so long as it has not been previously billed by any provider, because that's your initial visit. Let's see. Karen, anything to add to that?
No, thank you.
Okay. I'm just making sure I have everything. Oh, where do you, next question is, where do you access HETS information? Just want to cover that real quick again.
Okay, that is included in the resources. It'll be right here. This last link will take you to that HETS companion guide. and you should be able to find everything there.
Okay, well, at this point, I'm not seeing any further questions. So if we did ask you to email us, please make sure you do that. But otherwise, I have all the questions that we have.
Great, thank you. Okay, we will move along. So thank you for joining us today. Keep an eye on our live events page for upcoming webinars. The Preventive Services series will include us breaking down those individual services, like I said, so we can get more details with you. Our clinical staff is going to be providing the same, they're going to go over the same topics. It's not necessarily going to be in the same order, but they're going to cover the criteria and documentation portion of it. So when you go to register, just be sure to check the course description, as this is going to let you know if it's more directed towards the clinical part or if it's more towards the billing. On behalf of Provider Outreach and Education, I want to thank you for your participation. We look forward to your survey comments, and we hope that you will join us for future events. You may now disconnect.